we are going to speak regarding a very important and very common topic in pediatric orthopedics. Today we are going to speak regarding the angular deformities of the knee. The two most common angular deformities of the knee are, number one is a genu varum, or we call that bowed legs, or genu valgum, which we call as knock knee. So now what are these angular deformities? Are these pathological, or it is a normal physiological variation of our body? So to know this, we need to know the exact graphical representation of this angular deformities. When we are child, when we are born, the first day of our life, we all have a bowed leg around 10 to 15 degrees. That is absolutely normal. With time, by the age 1 to 1.5 years, this bowed leg get corrected and there will be absolutely 0 degree of deformity by 1 to 1.5 years of life. After that, there is valgus deformity like knock knee, and it accentuates. There will be an exaggerated valgus by 3 to 4 years of life, which is absolutely normal. By 5 to 6 years of life, this valgus deformity gradually decreases, and by 8 to 9 years of life, the normal valgus, which is 6 to 7 degree, will be restored. So this graphical representation is normal angulation of the knee. Suppose a child present to us at 1 year of age with a bowed leg, don't get panicked because that is normal for that age. But if a child present to us with a bowed leg at 2 years of life, that is not normal, because at 2 years of life he should not have bowed leg but the opposite angulation, that is the knock knee. So this 2 years is very critical for us. Any varum deformity or bowed leg which prevails after this 2 years of life has to be investigated. The most common cause of this bowed leg after 2 years of age is known as vitamin D deficiency, which we all say as rickets. Other differentials of rickets are there, but most common is vitamin D deficiency. So like this, if a child whose valgum deformity does not correct even after 5 years of life, so 5 years is again one more important landmark. If a valgum deformity does not get correct after 5 years of age, we say there might be some problem and we need to investigate that. Most important cause of persistent valgum after 5 years of life is bony dysplasia, that is some inherent problem in the bone. But alternatively, some metabolic problem like renal rickets can also be suspected, and caused has to be identified. So what is the treatment if a child present to us with a bowed leg after 2 years of life? When we investigate and we find the most common cause as vitamin D deficiency, we generally supplement the child with vitamin D substitutes. There are numerous substitutes which is freely available, and we ask the parents to expose the child to sunlight, especially in the morning. What is the solution for a valgum deformity after 5 years of life? It has to be investigated, and the treatment is individualized. Like if it is a renal rickets, then kidneys has to be evaluated. If it is a bony dysplasia, then we need to identify the problem in other bones or not, and accordingly treatment is done. Mostly the bowed legs gets corrected with vitamin D supplementation plus minus some bracing, but a valgum deformity after 5 years of life usually corrects with any medicines or bracing. It usually requires some form of surgery. Now the role of bracing in valgum or varum deformity is controversial, but we prefer to give it before offering any surgery because there are some research where it is useful.